Welcome to the Home Health Training Part 1. My name is Teresa Rada, and I'll be presenting Section N, Medication, New Item, and Revision. I am a physical therapist with experience in direct patient care, education, and administration. My experience includes inpatient, outpatient rehabilitation, home health, and hospice settings. Currently, I'm an associate at Apt Associates in Cambridge, Massachusetts. Here are the objectives for our session today. At the conclusion of this training, you should be able to discuss the new medication assessment item in Section N of the Outcome and Assessment Information Set, or OASIS, version E, explain the definition added to Section N, discuss new coding tips for the medication management items M2020 and M2030, addressing patients residing in assisted living facilities, or ALFs. Here is an overview of Section N in OASIS-E. The medication items from OASIS D1 have been reorganized into Section N to align with the other post-acute care, or PAC, setting assessment instruments. N0415, high-risk drug classes, use and indication. This is a new standardized PAC assessment item added to OASIS-E. Continuing with our overview, M2001 Drug Regimen Review, M2003 Medication Follow-up, M2005 Medication Intervention. In these items, the rationale has been added to each to align with the other PAC settings, along with some other minor changes. For M2010, Patient Caregiver High-Risk Drug Education, the patient's reconciled medication profile was added as a data source. M2016, Patient Caregiver Drug Education Intervention, was removed. For M2020, Management of Oral Medications, their coding tips were updated. And for M2030, Management of Injectable Medications, this item is no longer collected at follow-up, and again, the coding tips were updated. We will start by taking a closer look at the new assessment item in Section N, N0415, High-Risk Drug Classes, Use and Indication. Here is a screenshot of the new item in this section. For OASIS-E, this item will be collected at start of care, resumption of care, and at discharge from the agency. The intent of this item is to record whether the patient is taking any medications in specified drug classes, and whether the indication was noted for taking the prescribed medications. The item rationale stems from the fact that patients taking medications in high-risk drug classes or categories are at high risks for side effects that can adversely affect health, safety, and quality of life. Now we will review the definition for adverse drug reaction. This is a form of adverse consequence. It may either be a secondary effect of a medication that is usually undesirable and different from the therapeutic effect of the medication, or any response to a medication that is noxious and unintended and occurs in doses for prophylaxis, diagnosis, or treatment. The term side effect is often used interchangeably with adverse drug reaction. However, side effects are but one of the 5 adverse drug reaction categories. A side effect is an expected, well-known reaction that occurs with a predictable frequency and may or may not constitute an adverse consequence. Other categories for an adverse drug reaction are hypersensitivity, idiosyncratic response, toxic reactions, and adverse medication interactions. Now we will look at the item guidance for N0415. The following data sources can be used to complete this item: We have medical record review, clinical progress notes, other recent clinical documentation, for example, the discharge or transfer summary. Information can also be gathered from discussions with other healthcare providers at prior sites of care, patients, and/or caregivers. For column 1, using the data sources on the previous slide, you will determine if the patient is taking any prescribed medications in any of the drug classes listed. Next, you will check column 1, determining from the data sources if there is a documented indication for all the checked medications. Check column 2 for all that include an indication. Check all that apply for both columns. For code 1, is taking, this includes a medication that is part of the patient's current drug regimen, even if it is not taken on the day of assessment. It also includes anticoagulants, such as target-specific oral anticoagulants, which may or may not require laboratory monitoring. Medications according to the medication's therapeutic category or drug classification, regardless of why the patient is taking it. You do not code antiplatelet medications, such as aspirin extended release as N0415E anticoagulant. We have also listed a couple of other medication examples here for your reference that would not be coded. Dash is a valid response for this item. However, dash indicates no information, and CMS expects dash to be used in a rare occurrence. So what do high-risk drug classes include? Combination medications. These medications should be coded in all categories or pharmacological classes that constitute the combination. For example, prochlorperazine is dually classified as an antipsychotic and an antiemetic. Code as an antipsychotic regardless of how it is used. For long-acting medications, count only if they are part of the current drug regimen at the time of the assessment. For example, transdermal patches designed to release medication over a period of time, typically 3 to 5 days, would be considered long-acting medications and are included as long as they are part of the patient's current drug regimen. Include medications administered by any route. So you would include oral, topical, inhalant, injection, sublingual, parenteral, and by infusion in any setting, either the home, hospital emergency room, physician's office, clinic, any of those places, while a patient of the home health agency. Include newly prescribed medications that are part of the current drug regimen, even if the medication is not yet in the home and/or the first dose has not yet been taken. Now, what is not included? For N0415, herbal and alternative medications by any route are not included. These products are considered to be dietary supplements by the U.S. Food and Drug Administration and should not be counted as medications. Examples would include melatonin, chamomile, and valerian root. The discussion of guidance for N0415 is complete, so we turn our attention to the updates for existing items, M2020 and M2030, management of oral medications, and management of injectable medications. Here is an overview of the changes. Minor changes were made to guidance for both items throughout to improve or enhance clarity. Coding tips for both items were updated to help clarify medication management for patients residing in assisted living facilities. For a patient residing in an assisted living facility where the facility holds or locks up patient's medication, report the patient's ability to take the correct oral medications, including proper dosage, reliably and safely at the correct times. Determine ability based on observation and assessment of the complexity of the patient's drug regimen, as well as patient characteristics, including cognitive status, vision, strength, manual dexterity, and general mobility. Assessment includes consideration of whether a patient can get to the location where the medications are routinely stored at the correct times, recognizing that someone would need to make the medication available to the patient once they are at the location. For example, a nursing office or a medication cart. Whether or not the patient can recognize the correct medication dose or doses and take their oral and injectable medications. You would select response 0, 1, 2, or 3, depending on the level and timing of assistance required on the day of assessment to allow the patient to inject the correct doses of all oral or injectable medications reliably and safely at the correct times. Today you learned about the organization of medication items into Section N. We discussed the new assessment item N0415, high-risk drug classes, use and indication, and a new definition. We also reviewed the new coding tips for M2020, management of oral medications, and M2030, management of injectable medications, to enhance clarity about coding medications for patients residing in assisted living facilities. We welcome questions, and if you would like to submit questions you have about this presentation, please send them to pactraining@econometricainc.com by August 31st, 2022. All questions submitted will be reviewed, and those that are most common will be included in Q&A documents published after the virtual event. We invite you to attend the practice coding workshop that will be held in September. Based on the review of questions submitted, select questions will be discussed in a Q&A session during the September 2020 virtual live event. Thank you.